Hello, welcome back to Let's Talk About It with Kelly. This is my husband, John. He's the trichologist at Freedom Clinic Toronto, and
Hello.
I'm Kelly. This is season 2, and today's topic is going to be blood tests.
Well, it's a big one.
It's a big one. First question, John. What test should everyone with hair loss ask their doctor for?
Like I said, it's a big one, and the reason it's a big one is because there are hundreds of blood tests that can be run.
Right.
But the basic ones that everyone should have done or ask their doctor for when they're first investigating hair loss are complete blood count, which is all your red and white blood cell markers, your platelets counts, and that sort of thing.
Okay.
That's a standard test that is almost done with every blood test that's ever run. This CBC, it can tell you a lot.
Mm-hmm.
Then, iron, ferritin should be the first iron. There are several iron blood tests, but you don't really need to do them all at first.
Okay.
Between ferritin, which is iron storage, and your CBC, you can usually tell if someone is anemic or not. We'll often test some androgens, free testosterone. I like to test always on the first go around.
Okay. For men and women?
Yes, for men and women. Vitamin D, I'll usually test the first go around. So asking your doctor, CBC, ferritin, free testosterone. In women, DHEAS, vitamin B12, vitamin D.
But you have to pay for that one, though, don't you?
In Ontario, yeah, usually you'll have to pay for it in Ontario. Yeah.
But it's worth it.
At least 50% of the time, it's
I
low.
think more than that.
It's low.
Yeah.
It's always low. And people, it's surprising. How much does vitamin D affect hair loss? Well, it has to be pretty severe, but vitamin D has so many functions in the body. It even acts as a hormone. So, it can affect the hair. We want it, we want it to be at an ideal level.
Right.
Just to make sure it's not affecting the hair. So D, B12, if it's just a normal person, they have no health concerns, CBC, ferritin, DHEAS, free testosterone, vitamin D, vitamin B12, and I think that's about it for your first run.
Yeah. And these are what you would ask your doctor to do.
Yeah.
And you'd like to have these blood tests when they come in.
If they can have them done when they come in, if they don't have them
better.
done, well then, because it saves us time. But if they're not done, we can get them ordered through our clinic as well. So
yeah, for sure.
However we need to do it.
And this is the same for men and women.
Yeah.
All of them. Standard.
For the most part. Now, it'll change depending on what's happening with the person once we do their history.
Okay, so you're going to ask them to do the standard, and then when they come in for the analysis, if you need more blood work or depending on their analysis, then you'll do another requisition.
Yeah, so once I go through their history, we might find out that the person's a vegetarian.
Right.
Well, now we have to test serum protein. Maybe you have to
vegan.
test, or they're vegan. So, we have to test serum protein. We might want to start testing zinc and testing other vitamins and minerals that we know come from, meats, or come from more meats or dairy foods.
Mm-hmm.
A lot of vegetarians I see are not really conscious of making sure they're getting all their whole proteins.
Right.
Because you have to be, because, most of our whole proteins we usually get from meat and dairy. But, so if you're very vegan or vegetarian, then you may not be getting enough of that. So that'll change it. Okay. If the person has, some kind of other health issues, maybe they're on some other medications, then we might have to run some liver function tests. We might have to run kidney tests. So there's a whole bunch of things. And if we find that they've got a history of some other diseases or something, we might want to run some other blood tests. So there's a lot of things that can change
hormones,
what tests we're running, when we do our history.
What if blood tests are all normal, but the patient still has hair loss?
This happens a lot. So a person can have hair loss and their blood tests be normal. Then, we'll discuss what type of hair loss it is and what's causing it. But you can certainly have completely normal blood work and still have hair loss. Now, the other thing that's important here is normal isn't always ideal. Okay, so this is something mistake a lot of practitioners make. So they come in and their ferritin level is 30. That's within normal range, but it's interesting when you look at the interpretations on your blood test screening. It'll say, it's normal range 30 to 150. I can't remember what it is. It says right on there that, if you if your ferritin's 30, then there's a probable iron deficiency here. You've got, but many practitioners look at, that's in normal range, no problem. Mm-hmm. For hair loss, the standard is 70, ideal ferritin level. So, if you're at 30, there's a chance it's affecting your hair loss. So we want to try and raise that. So just because it's in the normal range, it doesn't mean it's ideal. If a woman comes in and we test her free testosterone and it's in the normal range, but it's 1 point below the high, then that high level of testosterone is probably affecting their hair.
Right. Okay. This happens a lot with thyroid. A lot of people, their blood work comes back normal, but they have all the symptoms.
Thyroid symptoms.
Yeah. You
have to start going in much deeper in thyroid. So actually, I forgot to mention that on our basic tests, the initial one. We always do TSH, T3, and T4.
Right.
Okay.
Right.
If we see there's some kind of symptoms, then we might want to run the thyroid antibodies too, because maybe there's a Graves' disease, maybe there's Hashimoto's, right, a hypo or hyperthyroid. So, but we always put TSH on the first run. We want that on there. And then if we see any symptoms of thyroid disease, then we'll run the other thyroid screeners to really investigate it deeper.
Okay. Thanks, John. What are the most common things you see in blood tests that can cause hair loss?
The most common ones are, so low ferritin and full-blown anemia. So low ferritin combined with abnormalities in the red blood cell counts and measurements. Definitely thyroid fluctuations. Now, thyroid's really tough because even once, if someone has a really bad Hashimoto's and, they've had hair loss, and they're dealing with it and they finally get their thyroid fixed up, often the hair doesn't return to normal even though...
Oh, really?
Yeah, even though their thyroid is normal. Why is that? I'm not really sure.
Oh, I didn't know that.
Yeah, so it gets difficult to treat. We'll treat it like androgenetic hair loss, but it's often different than androgenetic hair loss. It might just be a chronic telogen effluvium that just won't go away. They're just constantly shedding. And even though they've stabilized their thyroid, it hasn't 100% corrected the problem. So that can happen. So thyroid, very common. Iron, very common. We said vitamin D deficiency is very common, but it's not likely in most cases that it's affecting the hair unless it's a very severe deficiency.
Oh,
we
really?
want vitamin D, healthy levels to make sure it's not contributing in any way to the hair loss. So this is why we measure it, because it's so common. And we just want everything to be ideal, right? We want everything to be ideal. So vitamin D is very commonly deficient. So those are the three most common things. The other one, though, the testosterone levels and DHEAS.
For both men and women.
More in women. So
really?
Yes, because PCOS is very common.
And that's
call it PMOS now. Polycystic ovary syndrome. Now it's called polycystic metabolic syndrome, because it has so many other metabolic issues with it when you have this polycystic ovaries. So, but anyway, that so measuring the free testosterone and that. So I often see these levels high, but not over the normal range, not out of the normal range, but very close to the normal range.
Right.
And
normal but high.
Yeah, a lot of these people previously had PCOS. And most of their symptoms are gone, except their hair loss and probably their oily scalp and maybe even some acne. Those are all there. But their periods have returned to normal, so they no longer have PCOS. This is something that bothers me because I see the levels, of testosterone are still a bit on the high side, or DHS are on the high side, yet they're not being treated for their previous PCOS because now their periods are regular. Well, if you have all these other symptoms, you should probably consider treating the high androgens, okay? And there's some medications we can do that with. There's dietary changes that can be made, and there's a few things you can do to try and treat that. But getting the testosterone level down is going to be key in helping your hair.
Wow. What vitamins and minerals are the biggest culprit?
We talked about iron, like ferritin is iron, okay, B12 and D. Zinc is often very important. So zinc, it's easy to think that it could be deficient, and I used to always run blood tests. I don't run them so much anymore on zinc because I ran them for years and they were always normal.
So
Very statistically, it didn't seem, but I still will in certain cases if there's certain dietary things that maybe.
If you think they're anemic,
or their zinc is low, so we might run that. So those are the main ones.
Okay. Well, what about biotin? Do you test that?
No. So this is the thing about biotin. So biotin, well, we know it's important for hair growth, but so are many vitamins and minerals. Protein is extremely important, like protein levels. Very important for hair growth. But biotin it's like zinc, but even more rare for it to be deficient. It's extremely rare. So
many people take biotin.
So many people take biotin, and the studies show that it does not help unless you have a deficiency. But the thing is, nobody has a deficiency, or it's extremely rare. It's so rare that it's very seldom tested in any trichological analysis or dermatological analysis. It's never tested because it's so unlikely that there's a deficiency. And if there's not a deficiency, it's not going to affect your hair.
But it will affect your blood work.
If you're taking too much biotin, and this is often what happens, is people end up, they hear, oh, you should take biotin from, I don't know where that comes from, but it comes all over the place.
Yeah.
If you take too much biotin, if you're taking a high dose biotin, yes, it can completely affect
the blood work,
a lot of blood test results. Yeah, especially your iron and ferritin readings. It can throw them right off.
Wow.
So, and I remember this happening one time. I got some blood test results back from a patient. I had done the requisition, and I'm looking at this, and the ferritin was way off, and a bunch of the red blood cell counts were way off. Even there was some other ones that were way off too, and it just made no sense at all.
Yeah.
And I said, "Did you take vitamins? Were you taking vitamins around when you did these blood tests?" And he says, "Oh yeah, I took this multivitamin for hair loss before I did my test." And I look at it, and of course, it's got
biotin.
10,000 IUs of biotin, which is like.
So you shouldn't take anything before blood work.
No, you should actually cut out your vitamins a few days before.
Okay.
A few days or even a week before you do your blood test.
And working out, because I just found this out myself when I went to have my blood work done. Some of my levels were off.
Yeah.
And I had I had just worked out, and it was an hour later.
Yeah, creatinine.
They said
off the scales.
48 hours.
Yeah.
To not do any.
Yeah, because your body's doing all kinds of different things right after a workout, trying to repair and everything.
So guys, remember that. You need 48 hours. Do not work out and don't do your vitamins because you want accurate levels.
And that's also why a lot of blood work, we want it fasting, because even fasting, food can affect
So you think fasting 24 hours or 12 hours isn't enough?
Yeah. No, 12 hours is fine for fasting. Yeah.
But no vitamins. That should be included.
Vitamins need to be stopped days before.
Yeah. Okay. All right.
Especially if it's got high biotin in it.
Yeah. Okay. That's good, John. Can low iron cause hair loss even if someone is not anemic?
Yeah, absolutely. So we could have just a really low ferritin, a ferritin of 8. Now, usually if they have a ferritin of 8, there's probably going to be something in their red blood cells, but not always. Sometimes, they'll have low iron. They're not anemic. Maybe they're vegetarian. Okay, and they've got low iron because they're not supplementing it.
Right.
Okay, so that's common.
Right.
Okay, low iron just due to not eating enough iron.
You cut out the meat and the dairy and everything, but you got this whole other can of worms.
Yeah, exactly. So in those cases, usually you just need to supplement your iron and you're fine.
Okay, thanks, John. What hormones are the most important when investigating hair loss?
I talked about androgens when we're looking at PMOS. There's another condition that's very similar to PMOS, which is called congenital adrenal hyperplasia, and that cysts on the adrenal glands.
Okay.
You can be born with it, okay? But it can also be a late onset. So there's also something called late onset congenital adrenal hyperplasia. And and this will be similar symptoms to PMOS, like, irregular periods, hair loss, oily skin, oily scalp, because it also causes an increase in androgen, steroid hormones that can affect hair loss. So these blood tests, so if we suspect that at all, if we're running tests for PMOS, I usually run for adrenal hyperplasia as well, and that would be cortisol.
That's the stress hormone.
That's the stress hormone as well, and 17-OHP. So I'll investigate. Thyroid, hormones, of course, very common. Vitamin D is a hormone, so it does some. Yes, it has hormonal functions in the body, signaling. It signals.
That's why it's so important.
Yeah, it signals all kinds of things in the body. So, any substance that sort of sends signals to the hypothalamus or to the brain or some part of your body to release other hormones and perform other functions is considered a hormone. So vitamin D does do that in a lot of ways. And estrogen and progesterone are often really important, especially around menopause. We know they drop. Estrogen drops significantly at menopause, and therefore this can allow the androgens to have more influence on hair. Doesn't mean your androgens are raised, but if your estrogen is very low, estrogen generally, it has a protective. It protects the hair. Many women who get pregnant and they have androgenetic hair loss, they'll get pregnant and their hair will respond really well when they're pregnant. It's because the estrogen levels go up so high naturally, and that really helps protect the hair from androgens.
Wow.
So we may measure those, if a woman's getting early onset or hair loss before menopause, maybe they're perimenopause. So then you check those.
I think perimenopause is worse than menopause. Was for me.
Yeah, well, I believe it. Although I wouldn't know personally.
No. Well, there is menopause.
Yes, I know about menopause. I know a lot about menopause. I've been there.
Yes. Okay, last question, John. If blood test shows something is off, does that mean fixing it will fix the hair loss?
Unfortunately, not all the time.
Okay.
Obviously, it still needs to be done. It may not be the only issue. So if we have a person come in and their problem is a sudden onset telogen effluvium, or maybe they've had a chronic telogen effluvium for, a few months or years, where they're just constantly shedding. So telogen effluvium is just shedding.
Yeah.
Okay, it's just shedding. And in telogen effluvium, when the hair sheds, it regrows right away. Okay? So the person might not look like they're thinning on top, but their hair sheds like crazy. Okay? So in that case, we run some blood tests and we find, your ferritin is 6. We get them on iron supplements. It'll take 3 to 6 months for it to really
that long
respond.
For iron?
It could take that long. Sure.
Okay, so that's how long you give it. Okay.
And then yes, it's quite possible that everything will stabilize. But a lot of times there is a complicating androgenetic hair loss. Androgenetic hair loss is so common. So even in women, 50% of women will experience some level of androgenetic hair loss in their lives.
Wow.
Okay, so it's extremely common. So then the problem is if we get a trigger from a thyroid imbalance or a low vitamin, we get this trigger of telogen effluvium. When the hair grows back, it may start coming in thinner and finer, because they also have a androgen sensitivity, which causes androgenetic hair loss, which means when the hair is resting, the follicle or when it regrows, the follicle will produce a smaller, finer hair. This follicle has actually shrunk in the resting phase, and so when it regrows, the hair is thinner and finer. So then we've got now it's complicated. So in a case like that, where say an iron deficiency triggers an androgenetic hair loss. We solve the iron deficiency, maybe the shedding slows down, but we still get shedding and androgenetic hair loss, and we still get thinning. Okay, so
do you treat it too as well, like with PRP?
You would treat both conditions, absolutely. Right. Yeah. If you're seeing that there's evidence of androgenetic hair loss, yes, you got to treat the deficiency, and you've got to treat the androgenetic hair loss as well.
Wow, that's great, John. That was very interesting.
Yeah.
Blood work.
And again, it's extremely complicated, because if we start to, if we have, if we're running certain medications, if the person's on certain medications, we've got to check to make sure, their liver functioning properly and things like this. And certain medications, like if we're working with spironolactone, then we've got to monitor people's electrolyte levels. So, right. If they're taking finasteride, we've got to monitor their liver function on a regular basis. So right. The blood tests change a lot depending on the situation.
Right. So that's what I'm getting from this, is that you can get the standard from your doctor, the basic. When you come into the clinic and see a trichologist, then it's a total investigation.
There may be a lot more to investigate.
Yeah, because their medication and their lifestyle and,
all kinds of things,
all kinds of things. Wow, that's great. Thank you so much, John.
Okay.
I found that very interesting.
Good, great.
All right, we'll see you next time.
Okay, bye.
Bye.